Hello, I'm Dr. Adriana Potter. On the Let's Get Physical today, we are gonna talk about a little bit of the neck and how we can actually help to manage the aches and pains that comes when we are physically active, as well as when you start aging and develop some orthotic changes. As we know, everybody's gonna develop some level of arthritis in their joints, and it's inevitable to have some aches and pains as we age. So what we do about that, of course, we're going to try to use the pain management information that I have shared with multiple times in videos in this channel, using heat, cold, topical gels, electrical stim. All those things can help you. But in addition to that, on today's video, we're going to talk about how you're doing some of the self-massages and using some of the props that is available for you to purchase either through the links in my videos or through the stores, local stores but nearby you, okay? Before we get started with doing the self-massage, let's just understand a little bit why I'm going to be using these props by understanding your anatomy a little bit, okay? Here we have our spine, okay? And everybody has that lordosis, which is a little bit less curvature in the neck. Because of poor postural mechanics, this curvature tends to kind of change over time. And if it gets altered, it will accelerate the process of arthritis and create a lot of muscle guarding, okay? So posture is very, very important. But sometimes we need to get our helpers. So kinesiotape is a good asset, and I will be sharing in the future video techniques for kinesiotape for the neck and shoulder, and that will help you with the posture. But in the meanwhile, we're going to be doing a little bit of some of the posture re-education with the assistance of the foam roller, okay? So a lot of the neck muscles, they attach to the base of the skull and goes into the vertebral bodies in here to the cervical area, and some of them come very low, almost in between your shoulder blades. So shoulder blades is going to be around in here, and then we're going to have a lot of these muscles from this section of the neck here and there going to the top of the shoulder, and many of the muscles of the shoulder kind of will have some effect on the neck. So neck and shoulder kind of goes together. When you're having a dysfunction, you want to make sure that both areas are being treated by your physical therapist, okay? But a lot of the things that we're going to be doing in terms of self-release, it will involve some pressure points into the shoulder blade, the top of the shoulder, and a little bit into the rotator cuff, as well as on your mid-thoracic, okay? Alrighty. My first tool is something that can be easily used in the office. And it's called the Terra cane, the wand. There's different things for you to think about it, to use it. There's different models out there. So there's no one is better than the other. It's a matter of preference. I found this on the website, and this one is actually called Body Back Buddy, okay? What I like is that you can be sitting and using these knobs in here to make some of the pressure points that you're looking for. And you might be doing that also in laying down if you're looking for a little bit more relaxation or a little bit deeper pressure, okay? This knob, it will be going into your shoulder muscles in here, okay? And then you're just kind of pressing into the area that you feel like you wanna do a little bit of that pressure. So you can press it and hold, and then you can move your neck in different ways, and you may find out that the pressure point, it kind of gets a little bit less tender or releases the longer you hold that pressure here. You can also do a little bit of the striking mode, so you're actually moving your wand. I'm exaggerating the motion here, but you can move small movement, or you can make a big stroke. And if you go straight on the skin, you probably will be able to see a little bit easier, and just help you with that. Alrighty. So you're kind of getting out, you put oil on the skin, and that will help you to release a little bit of that tension into the muscles. You can also go a little bit in the neck. Word of advice, if you're using on the neck, be very careful and gentle. There's no need to be aggressive with this tool in here. But you actually find the little spots and doing some of the little jiggles into the neck area. We're not trying to move a joint in here when you're using this tool. We're trying to find the trigger points and release the pressure and the pain, okay? So if you are causing more pain or you're feeling worse afterwards, this tool is not working for you and you need to find something else, okay? So there's no right or wrong about which pegs to use. It's a matter of being creative and finding out which one is going to give you some good relief. And of course, you can also use for the lower back and getting, you know, the round area here, and you're gonna find that it can go all the way along the spine. I prefer the round ones versus the pointy one, but like I said, it's a preference thing. So you can kind of go into the back, and you can kind of massage in here, and you go all the way along your spine in there. So you kind of find it where you want to work. And here is actually a little bit in the shoulder blade, and it feels very, very good. This one also is another one that you can use it around the neck area, because you put it here, and you kind of using both hands, and you find it here. Then you just kind of massage in the area, and you can also do it on the spine area. There's no right or wrong. It's just finding what's worked for you. The nice thing about Amazon, you can try these things, and if in a few days you find like you don't like it, you still have time to return it and get something else for you, okay? My next thing is actually the tennis ball. Different ways you can use the tennis ball. You can use it in standing in the wall. I'll show you in a little bit, but you can also do it leaning down, okay? Laying down, it gives you a little bit more control of the pressure, but it's also using your body weight, okay? So if you're having a hard surface, there will be less of the giving of the ball over your body over the ball actually, and then it will be a matter of preference about how much pressure you want to do it. Usually for people that wants to do a lot of pressure, this is perfect for that, okay? So for the shoulder blade, we're looking for getting the ball around in here on the spine, okay? This is just 2 tennis balls wrapped up with some sticky tape. In this case, I use the kinesiotape. And then you see the ball will kind of make a little bit of this gap. And you want the bony process of the spine, okay? So this area here, you want to be this kind of rolling up and down. And you can do on the wall or you can do on the floor. We're also going to be using the ball up and down, and it will be right between your shoulder blade here and your spinal body here. And you can actually do some shoulder movement. I'm going to show in a second, okay? You can also use the ball on the base of the skull, and it actually feels amazing in there. And lastly, you can use the ball a little bit on the rotator cuff. And on the rotator cuff, this is the area we're talking about that we're going to be doing it, okay? So let's go over it. Alrighty. So now we're ready to start doing a little bit of that into here, right? So I'm using started right a little bit below my shoulder blade, and I'm gonna lay down. If you find that there's too much pressure, you can put a pillow in there, and you just, in this case, this one actually will move some joints, okay? And you just laying down. So the ball is pushing you that way towards the ceiling, so it's coming from the back towards the front, which is a mobilization for the spine, trying to extend in your spine. So you actually go here and you can do right rocking. If moving feels uncomfortable, don't move, just breathe and let your body relax in there. And if you feel like you got enough for that segment, you're gonna move just about an inch, either above or below. We're gonna move the ball a little bit above. So I'm gonna slide my body lower. That is it. I'm on a different segment now, and I do the same thing. Move right to right, left, go up and down a little bit, or move my knees left and right. There's no right or wrong. And once you feel like you're done, you're gonna move to a different segment. And now I feel the ball right a little bit in between my shoulder blades. And that's when I start moving a little bit my shoulder and using the pressure of the ball against my bones. In between is the muscles being sandwiched, and I get a little bit of that trigger point release in there. You kind of feels very nice. So, and the ball is right there, okay? So you wanna make sure that you are relaxing and releasing it. Okay, now I'm a little bit in the middle to the higher portion of it, and I feel like, oh yes, this is my spot. And you stay there for as long as you need it. Make sure you're not rolling so much that it irritates. So you go up and down. You can move your shoulders in circles. I like to keep the elbows bent because here's a bigger lever arm. It feels the heaviness of the arm, and here's a little bit less heavy, and you can control the motion a little bit more. Oh yes, that's the spot on my right side. So you're kind of working into that, okay? And you go
One thing that I forgot to mention in the video is actually to always stabilize your muscles and joints after you're doing some stretching. And I'm suggesting here the abs and shoulder stabilization exercise video that it is in this channel for you to do following doing these stretches. So your body knows what to do with the new relaxed position that your joints and muscles are finding at the end of the stretching session. So make sure to always do a stabilization exercises, and you don't have to do all the exercises that is suggested in these videos, and you can do just some bird and sun and bird. You can do just some cat and cow on hands and knees, or a little gentle planks. Anything goes. Just make sure to always stabilize your joints so your body knows what to do with the new softness that you're encountering after doing the stretches.